All right, everybody, welcome to day 2 of the third annual meeting of the NICHD's Maternal and Pediatric Precision and Therapeutics Hub. I said NICHD there very intentionally because this is really something that is housed within the obstetric and pediatric pharmacology and therapeutics branch within the NICHD, but it really is a hub that we view as serving multiple branches within NICHD, as well as a lot of different efforts across the entire NIH and other federal agencies such as the FDA. Very much, and we'll get to this a lot in this afternoon, is how the MPRINT Hub can partner with different groups, with different efforts, such as the Maternal Fetal Medicine Unit Network and Neonatal Research Network in our Pregnancy and Perinatology branch, and thinking about different ways that we can also work with networks and activities supported by other branches, such as our maternal and pediatric infectious disease branch, and a lot of the work that goes on there and funded through networks such as Impact and Global Health. So that will be a really strong focus later on this morning. We're also going to be hearing some updates on PREGLAC and a working group of council. This is a task force that Congress mandated be created back in 2017 as part of the 21st Century Cures Act, which is really trying to come up with implementation recommendations for research in pregnant and lactating persons. And I bring that up, and I also want to bring up the BPCA, the Best Pharmaceuticals for Children Act, which was passed originally in 2002 and mandated a program for the NIH to run to support training and research to conduct label changes for pediatric trials. I bring those two programs up specifically because they are the congressional mandates that essentially fund the MPRINT Hub. So like I brought up a few times yesterday thinking about pediatrics, I want to make sure that we think about both pediatric medication and drug treatment as well as that in pregnant and lactating persons. We need to make sure we strike a reasonable balance with that. Certainly recognizing that health in pregnancy and medical treatment during pregnancy impacts children into their, through their development and into adulthood. But, we should be thinking about what we can do in both pediatrics as well as pregnancy and lactation. So I don't want to take up too much other time. I do want to go through a couple funding programs and funding opportunity announcements. Yesterday, I was listening to the conversations and some of the questions. I thought it would be good to highlight these, and we'll distribute the slides and hopefully run them during breaks if you want to grab QR codes. First is a common fund program called Complementary, which I have to read because it is focused on complementing research in animal experimentation. It's not intended to replace animal research, but really to focus on human models in human-derived tissues. So this program really aligns with what Gil was talking about yesterday in terms of developing novel approach methods, new alternative methods. We use NAMs. There's a variety of different definitions behind the acronym that I think the community is still working on. So this program is currently under consideration by the Common Fund in terms of scoping. So please go to the QR code if you're interested, get on their mailing list so that you can be one of the first people to get the RFAs when they come out, because it's going to be a great opportunity. As part of the launching of the program, there was a challenge for prizes. There's $1 million purse bag. Each award could win up to $50,000. 20 awards were given out. You can see the awardees here. I was very happy to see that 4 of these were relevant to NICHD's mission in terms of reproductive health, pregnancy, and pediatrics. So very good turnout, 20% of the awards. So this program is going to be impactful in terms of generating tools that'll help us assess safety and efficacy in our populations. This is another RFA. This is from our colleagues over in NCATS. This focuses on pilot projects for understudied proteins associated with diseases. For those that are maybe a little bit more molecular pharmacology or have colleagues that think about molecular pharmacology, this lists transporters, GPCRs, kinases, and ion channels are also in scope to that. So I just wanted to toss that one out. This funding opportunity is run out of OPPTB by Dr. Katie Vance. We have multiple participating ICs on this, including mental health, NIDA and NIAID, as well as support from the Office of Research on Women's Health. This is a funding opportunity. It's a PAR for R01s or R21s that very much focuses on maternal and pediatric therapeutics. It's in a review venue that does a great job, understands the complexities there as in translational research. So if you're thinking of R01 or R21 type science, this is a good route to go. Lastly, and Bob Timborough will talk about this more this afternoon as we start talking about our networks, but I do want to highlight the fact that the NICHD has recently retooled how we take our approach to multi-site clinical trial research. So there's 5 networks that are listed here as being the initial ones that are incorporated in this. There's now a new process to develop concepts for clinical trials that can come in. So as people are talking about, you know, different ways that we can utilize clinical trials, opportunistic studies, randomized control trials, et cetera. This is a great way to tap into networks. And this will really underlay a lot of what we're thinking about in terms of collaboration and what the MPRINT Hub's role can be. All right, so I just wanted to make sure people were aware of some of those opportunities. And with that, anything else? All right, so I would like to, the next session is going to be an update on the PREGLAC implementation status. So this is a working group of council that is evaluating the program, as I mentioned. And I'd like to introduce Dr. Sue Rahman, who has 25 years of experience in academic medicine, is currently the Chief Scientific Officer for Health Data Synthesis Institute. She is one of the co-chairs of the working group of council for that PREGLAC evaluation. She has a lot of experience with the Pediatric Trials Network, so I'm really excited to have her give an overview.